Hello, my name is Chelsea Panacea, and I am here to present a practicum review, steps developing a grant proposal and the lessons learned. So my practicum site was through Child Family Health International. This organization is an American organization that is based out of California. You can see that on slide 1. And they place students, practicum students, volunteer students, internship students with organizations around the world. So I was placed with an organization in Uganda called Kigezi Healthcare Foundation, and I was directed to work in contact with the director there. On the next slide, you can see a little bit about Kigezi Healthcare Foundation. They are an NGO nonprofit. They've been serving the Kabale area of Uganda for over 20 years. Kabale is in the very most southern part of Uganda. As I said, my practicum preceptor was Dr. Jeffrey Nguyo. He was the CEO and the founder, and he currently works there as a physician as well. Kigezi Healthcare Foundation does community outreach. They also have an acute clinic that is located right in the middle of Kabale. So the community outreach programs range anywhere from cervical cancer programs to nutritional development programs. They also do a dental program where they invite the community and they have a day for a clinic, and the community comes and they do free health assessments. On the next slide, you can see the vision and the mission of Kigezi Healthcare. So their vision is to have an educated community that's free of poverty, related communicable diseases, and adequate and sustainable income at the household level. And their mission is to fight disease, poverty, and ignorance in an integrated and sustainable approach. So what they'd want to do is they want to start at a bottom-down approach where they empower the community to be out of poverty to support themselves, which leads to a better health outcome. As they stated, it's very integrated between poverty and low health outcomes. On the next slide, we decided with my program preceptor that the problem was the difficulty to have access to water in the Kabale area. Kabale is very mountainous and it's very strenuous for families to go get water. Oftentimes it's down and back up hills. And so it takes lots of time and it takes lots of energy for family members to go get water, and water that's not even clean. So in 2016, there was a group that had come and developed a prototype of an underground rainwater system that they had in Kabale. And what that did was provide rainwater harvesting from the roofs of family members, and that has provided clean water right on the homestead for the family. So with my practicum preceptor, we decided that producing a proposal for funding for a program that allows more underground rainwater systems to be developed for these people of Kabale is what this organization needed. As you can see in those photos, that's an example of one of the underground rainwater systems, and there's a pump that pumps the water out, as you see in one of those pictures. The SMART objectives that were chosen the first one was, by the end of the practicum, the student assessed population needs, assets, and capacities that affect communities' health, as measured by, in this case, the research proposal for funding. So this was done through the expert interviews that I had with Dr. Nguyo over the course of the practicum. The second SMART objective was, by the end of the practicum, the students selected communication strategies for different audiences and sectors as measured by health promotion strategy for hand washing, included in the grant proposal. So this is where we developed professional collaboration between us developing a hand washing program a flyer that is to be distributed out to different audiences, like kids, families, churches, so that when the access to water, it has increased, when people have access to water, then they are able to understand the importance of hand washing and how that lessens the burden of disease. The third is, by the end of the practicum, the student applied awareness of cultural values and practices to the design of a health promotion strategy in relation to this rainwater harvesting system as measured by this health promotion strategy. So this is cultural relevancy. So when developing the hand promotion strategy, we weren't using, the practicum student was not using, images that didn't relate to the community. So oftentimes the community will wash their hands in outside settings with an outdoor hand washing station, not an indoor one, unlike much of the Western community. So the fourth was, by the end of the practicum, the student will be able to create a public health intervention to address a population level need for Uganda based on the analysis of cultural, social, behavioral, and environmental factors that contribute to the problem as measured by the health promotion strategy. So this is the same with hand washing. The hand washing flyer was given to different audiences. So those audiences had to be evaluated what their cultural, social, and behavioral attitudes were. And the last was, by the end of the practicum, the student evaluated development programs and projects in terms of their quality, effectiveness, and efficiency using qualitative and quantitative methods as measured by the research grant proposal. So this was based on evaluating and analyzing the past rainwater harvesting systems and doing professional development with Dr. Nguyo about what could we change to make this a more effective system. So for example, making the water tank that's underground a bigger surface area so more water can be collected. As you can see on the next slide, the deliverables were the grant proposal that I delivered to Kigezi Healthcare Foundation. And then there you see the hand washing flyer, two-sided, talks about steps to proper hand washing and then when you should wash your hands as a community when they have access to water. The outcomes of this, as you can see on the chart on the right, the SMART objectives are listed at the top. So after the development of those SMART objectives, it was measured through the deliverables, which were the funding proposal as well as the hand washing flyer. And that was done through the methods, which was the expert interviews, the data analysis, literature review. And then all of that produced results, which in turn helped me develop the grant proposal, which showed the competency of the SMART objectives. So some of the practical outcomes were was an application to the Australian government program. It's called Direct Aid Program. We submitted the grant proposal preliminary to the Australian government to receive funding to fund 40 different underground rainwater systems. There's also future applications such as Ugandan government programs or another one called ADDIX or ORIX Foundation, which can also provide funding. In short, access to clean water equals decrease in the burden of disease, and that is the goal of these outcomes. And in the last slide, a couple learned experiences is public health can have many barriers for promotion strategies. One thing that I've learned is that you can't even talk about hand washing until you have access to clean water for these people. Secondly, is learning a culture virtually provides a very unique experience. I found myself depending on my preceptor, my practicum preceptor, for a lot of information and expert interviews, and then there was a lot of research, but it was definitely a unique experience and beneficial in some ways. And then also, I learned that public health is a wholesome approach. So yes, we were working on an underground rainwater system, but really you had the pandemic in the background. So COVID response, the country shut down for 6 weeks. It makes everything kind of shift with it. And that was something very interesting and something that I gained value in during this practicum experience. So thank you.